addictions, we think about drug addiction, gambling addiction, alcohol addiction, which it is. But there's also other forms of addiction, isn't there, when we are in this new world of social media and internet, etc. So I'm going to open up a very wide question for you, Yasir. Do remember that most of our listeners are not from the healthcare background, are the general community. But we also have a lot of professionals from healthcare and other professions as well. Do join us. So just to let you know that when you do respond, just keep in mind in relation to some of the medical terminologies which some of our listeners may not pick up. So over to you. What is addictions, Yasir? Absolutely. Absolutely, Yasir. I'm sure we're going to get. I mean, I've already got some questions, but I'm going to go through the basics first, so that at least people or listeners rather can sort of understand what actually is. But thank you for that. I think that gives us sort of a very broad understanding of what addictions can be. I mean, from a historical perspective, but also in the contemporary, from a contemporary perspective. I mean, you've touched on, even social media. I'm sure a lot of people are. It is very topical, isn't it? But I just want to remind our listeners that please do join in. Any questions at all for Yasir? Give us a call on 0116 4822 086 or text us or WhatsApp us on 07748855055. Join us on Facebook on Ramadan.fm or Instagram or YouTube and ask questions there as well if you don't want to call in. But yeah, so Yasir, just moving on, you sort of explained the very basics of what addictions are. Now, when we talk about addictions, a lot of things can come to mind, as you've already highlighted. So when does an addiction, or rather, what's the difference, in your expert opinion, the difference between an addiction and dependency? Yeah, and that's really interesting, Yasser. And just to touch on what you just said, um, what is the role of dopamine? I know a lot of people may have heard of the neurochemical dopamine. I mean, as a psychiatrist, we understand that dopamine is this something that we get as a kick, instant gratification, as opposed to some of the other chemicals. What is the role? I mean, when we go onto social media and we get likes, when we take certain drugs and we get a kick, when people take alcohol and they get a kick, when they gamble and they win money and reinforces and have a feel good factor and get a kick. So, what role does dopamine? Is that a real thing? Dopamine in the brain, is it involved in addictions, dependency? Sure. No, no, absolutely. And I think there's a lot we can tease out of that now, Yasir, because I'm sure just to break a few things down. Now, just to let me try to ask a simple question, if it's such thing as simple question, Yasir, just for the sake of our listeners to pick up on some of the things that you said. So before I do that, just a reminder to our listeners to call in 0116 or WhatsApp or text us on 07748855055 and come in, talk to us, ask questions, any comments, etc. We've got Dr. Yasir Abbasi, who's our expert consultant psychiatrist on addictions. So Yasir, these things that you've explained, the whole concept of addictions, dependency, dopamine, getting a kick, feel-good factor, who does it affect? And or let me ask it this way: can any of us be victim to addictions, or do you have to have a certain kind of, dare I use the word personality, or have the certain traits in order to have that addictive personality where, because the reason why I'm asking this question is that when patients are referred to us in mental health services and they have a previous history of drug use, we're very careful prescribing them certain drugs, for example, drugs like benzodiazepines, because we fear that because they've had a previous history of addiction, they may experience or may go into that, get stuck into that addictive phase once again. Is that true? Is it just a myth? Is it just our anxieties? Or do you have to have a certain personality? Or can it affect anyone? I'm more of a tea fan. Yeah. I have three. I could have more, but I'm very conscious. I'm very conscious that I shouldn't have more than that. Yasser, I'm just going to stop you right there because I think we got a phone call. So we're going to get a question. So I'm going to hand it over to our studio to Akil. Yes? There is a phone call. Okay, there is a phone call. I beg your pardon. Hello.
Hello, Dr. Shahid Latif. Assalamu alaikum. This is Selina Hafiz.
Assalamu alaikum, Selina.
Wa alaikum salam. I hope you are both well.
Selina, we are both very well. First of all, thank you very much for calling in. I did get your question on Facebook, so thank you very much for that. You are a keen follower of Ramadan FM's, so thank you very much. It's really good of you to call in. So what I'm going to do, Selina, I did see your question, but I'm going to give you that opportunity to talk directly to Dr. Yasir Abbasi and fire away with your question.
Okay, sure. It's actually a slightly different question to what I messaged you about. But what I wanted to ask Dr. Yasir is that the social media is another kind of pandemic unfolding that I can see in the future. To prevent that, is there measures that people can teach their children and be aware themselves that kick in without them knowing, and things that they can actually self-do themselves to prevent them going towards addiction? Because sometimes addiction can be blind and you're kind of like driven into it without knowing.
Did you get that question, Yasir? You got the question? Yeah. Yeah, yeah. I just wanted to say, I just wanted to make sure that Selena is following because I know she's quiet. You are
Yeah,
able to.
no. I am listening to Dr. Abbasi,
It's
and
just to add, Selena. I was forwarded a link which I'll forward you by Zed Sheikh, who works with the Radio FM, and it was really good. It's called Digital Detox, and there's a village in India which actually has passed a law by the community leader, who actually says that between for about 1.5 hours every evening, in order to promote family time, um, 1.5 hours is going to be completely a digital detox, with nobody, including parents or grandparents, may I say, or any other kids, etc., having no access to television, no access to phones, etc. They put their phones away and they have pure um, um, family time, which is, I don't know what Yasir would say about that, but maybe. Before I ask Yasir, I just want to go to Yasir's to Selena's second question, which we did ask. And what she did was, what addictions are evolving with social media in view of people's lives in reality and on screens, on mobiles, and eventually the virtual world? Will this create a dual personality? And if so, which one will become the real version of who? That's a fantastic question, Selena. And most of us may have watched the film Avatar, where we're in the virtual world and then we're in the real world. So I don't know. Thank you for that, Selena, for that question. Um,
yeah,
did you want to
thank
respond to
you.
that, Yasser?
Yeah,
Oh, sorry, Selena. Do you want to say something?
no. The questions that I'm throwing to you both are because I'm aware of these things happening. I've been monitoring for the past kind of like 10 years on what's actually happening around us and how people are changing, and I'm observing a lot of things. So my questions are around there. And with the professions that you are both in, is there something that psychiatrists are coming together, because I really do feel that there is a need for screening on stages of mental health where people are. With the pandemic that we've gone through, it's affected many people, even professional, people who are really strong-minded, and there's different levels of mental health that's affecting people. And if some kind of screening is done where people can go willingly and just find out their mental health, and then the kind of culprit is dealt with at the beginning rather than being left, and then it becomes a kind of a health issue. So so my questions are going towards that side of things.
Yasser, you want to?
Yeah. No,
Excellent. Thank you, Yasir.
absolutely.
Selena, thank you very much, so much
Thank
for
you.
calling in. Thank you for the
Yeah.
questions, and thank you also for following Ramadan FN regularly. Please continue to do so, and we look forward to hearing from you again next week.
Yeah, no, absolutely. I'm always interested in different topics of conversation. We don't hardly find people these days that are talking about serious issues that are going around. So it's been refreshing to speak to both of you, and may God bless you both in this beautiful month and your families, and lots of love from me to all the listeners.
Thank you
Take
very much,
care.
Selena. You take care too. Thank
Okay.
you very much.
You too.
Assalamu alaikum. Okay, I'm just conscious of time, Yasir, and I think we've got just a little above 6 minutes left. But I do want to ask you more questions. But before I do that, there is time for another phone call if anybody wants to call. Just a reminder: 0116 4822 or WhatsApp us or text us on 0774 885. Where is it gone? 55055. So it's 0774 885 there is a question which I have received from Amr Afzal. Thank you very much, Amr. He's texted us, and his question is: Assalamu alaikum. How can we control our children's addiction to social media? But as parents or adults, we are avid social media users. I think that's been touched on slightly. Just conscious of time. Is there anything additional you want to add to what you've already said, Yasir? No, no, it wouldn't indeed. Thank you, Amr Afzal, for that question. Please keep them coming. We've got just a little under 5 minutes left. Yasir, I just wanted to ask you, um, just in relation to some of the common addictions you see in your daily work. You've already touched on that, but also you do prescribe as a psychiatrist and a doctor. You do prescribe to patients. Surely you can't get addicted to something that's prescribed by your doctor, can you? Excellent. Wonderful. Yasir, we've got about 1.5 minutes. Can you, while we are talking about kind of medications that are addictive, can you please kindly debunk or demystify and inform our listeners about antidepressants, about them being addictive or not addictive, and the protocol of use and why people think they might be? So there's about 1.5 minutes, if that's okay. Yasir, I'm going to stop you there because we've got just about 40 seconds left. And I want to say thank you so much, Yasir, that in this short space of time, I know I've asked very, very specific and open questions, and I think you've handled them, as always, really well. I want to thank you and hope you have a good Ramadan and continue to have a blessed for you and your family. So thank you so much for joining us on Ramadan.fm. And And I also want to thank our listeners for joining in today. We will be continuing our Health Matters show with myself, Dr. Shahid Latif. Continue to join in, and any questions, any queries, any topics, please. Until next week,